3 years ago, Lauren's baby daughter Jada died in her womb the day before she was due to be delivered. Lauren says the staff on the maternity ward didn't try to close ranks or make excuses. Like her, they just wanted to discover why it had happened.
They didn't ever defend themselves. I was quite lucky in that they really showed me that she mattered. And I remember when she was born, the midwife actually started crying. And I thought, why is she crying? You know, she's a professional person, she shouldn't be doing this. But actually, it's because the baby meant something to her too.
But all too often, midwives and doctors don't feel they can be open, out of fear their hospital will be sued.
Congratulations.
Thank you.
Now the Health Secretary has plans to make NHS maternity care the safest in the world.
I felt sorry for my wife because when we had our number 3, I was Health Secretary.
And he wants to start by dismantling the culture of blame and litigation.
That we make people fight through the courts, typically 11.5 years, to get compensation for a brain-damaged baby. And we want to find a better way of doing that, which is better for the parents, giving them access to compensation earlier, but also better for doctors and nurses who are very traumatised by what, it's awful for them in those situations.
So the government plans to make sure doctors and midwives can safely admit mistakes without the risk of that being used against them. That there's a system which spreads the lessons learned from that across the NHS in England. And there's a fast-track compensation scheme which avoids legal action when a birth does go wrong. But midwives leaders warn it doesn't tackle the greatest threat to maternity care, that England is 3,500 midwives short of what's needed.
Without enough midwives to care for women and also to participate in the multidisciplinary training, in the case reviews, the benefits of this strategy will not be delivered.
Medical errors harm around 500 babies at birth each year. This new approach should cut that number and reduce the burden on families and on the NHS when mistakes do happen. Catherine Jones, 5 News.